Lovely stuff. Brilliant. And then I'm going to hand over to our first speaker, Alison.
Hi, hello everybody. So I'm Alison Walker. I'm based at, I work for the Library Service and based at Central Library. I also may know some of you through Read Easy. I'm also a volunteer with Read Easy and accept any referrals for any adults who are struggling to read. So if anybody wants to refer anybody, that's I'll be happy to take those referrals. But my main focus today is on our home library service. So this is a service that's aimed at people in the city or residents in the city who are unable to get to their local library because they have health reasons, disability or mobility issues, and they spend most of their time at home. And I'm sure a lot of you on this network maybe do come in contact with residents in the city who, who are spending a lot of time at home and may need, this service. So what it is we make deliveries to residents in the city. We make them direct to their home. So we deliver books, we deliver spoken word, we deliver large print, whatever the residents would like, and we sign them up to what's called the home library service. And how it works is, so we've got two members of staff who will phone any customers and talk to them about the type of books that they want to read or listen to. And we will arrange a delivery to their home address. What's really good about the delivery service is that it's actually the deliveries are made by an electric bike, or cargo bike. So it's actually environmentally friendly as well, which we think is quite a nice selling point given all the issues with climate change and Southampton trying to be a greener city. So those deliveries are made once a month, and we make the deliveries, and also the books are collected once the person has finished reading them. So members of staff will ring them up every month and arrange that. And yeah, so what we're doing at the moment, we're working with partners, the City Council and also Future Transport Zones, which are looking at how deliveries are made across the city and how they can be made greener. And we're also working with the university to get some stats on the logistics around delivery and deliveries, and to look at maybe expanding the service so that we not only deliver books, but we also deliver prescription medicines, for example, newspapers and magazines, so other things that we could deliver at the same time. Our main focus, obviously, for the library is to make sure that people have access to books if they would like to, and we don't want them to be, just because they're at home and missing out. We don't want them to be missing out on their local library. So we're basically bringing the library to them, and it's a free service. So it's completely free to sign up. It's completely free to have the deliveries. So we're looking to expand the service over the next couple of months, and we really would like to. We're really interested to know if you know of any customers or clients or patients who may benefit from the service. We ring them up. We'll organise it all. They just need to, sort of, I suppose, be in for the deliveries, but at the same time that can be sorted if they're not going to be in. So yeah, so it's just, if you've got anybody who is interested or may be interested or is interested, for the future, if you come across anybody, then just give us a just contact us, and we can contact them and set them up, and they can then, you know, enjoy reading or listening to books. So we don't want them to miss out. But that's basically it. That's
Brilliant. Thank you very much. And you know, as we spoke about this, I think it sounds like a fantastic service. Really, really brilliant. And you know, it gives people, you know, who might really enjoy reading the opportunity to do that again if they're not able to kind of get to, you know, taking the library to them. If you've got any questions, pop your hands up and you can put them to Alison. I did just see a comment in the chat. I guess I've got kind of two questions from me. So question number one, so is the referral process to you just, you know, someone gives you a call, they say, I've got Mrs. Jones, she would like to get some books, she, you know, she's happy for her information to be passed on, can you contact her? And you just go, yep, cool, you know, that's fine, we'll give her a shout. So it's as simple as that.
Yeah, it's as simple as that. And I can give phone numbers and email addresses. We've got leaflets as well, so if anybody would like a leaflet or a poster, we can distribute those as well.
Brilliant. And I guess my sort of second question would be, how are people, if you've got someone who, you know, they say, oh, I like reading crime fiction, but I don't know what's good. You know, I've read the Millennium trilogy. You know, do people have to kind of know the books they want to get, or would perhaps the librarian have a chat with them to maybe make some suggestions about what kind of things if you like this, you'll enjoy this type of thing?
Absolutely, that's a great question, Joe. Thank you, because basically, yeah, I mean, our library staff will talk to the person about the type of books they like to read. Usually, the person has an idea of the type of thing that they like to read, and then based on what they've told us, we can make recommendations of other authors that they might like based on what they've told us. And also what we like to do is, because I think it is a bit of a get to know the customer and what they do like, and we do encourage feedback from the customer on the type of books that we've supplied to them, especially when it's the first time, just to make sure that what we're supplying is what they want. And we've got, you know, we've got thousands and thousands of books, some in audio and large print as well. So we're hopefully trying to cater for all customers and in different formats. So yeah, it is just as easy as just to give us a call, and we'll bring the person and we'll set them up and we'll organise the delivery. And once they're finished with the books, then we'll collect them as well.
Fantastic. That was going to be my follow-up question. We've had people in the library before, and I've mentioned, you know, I always worry a little bit I'm going to burst into flames when I go in Southampton libraries because I've got so many library fines from when I was a child. Luckily, that hasn't passed over to where I live now. So when the book is ready to come back, you know, you'll go, we're going to come and get this book from you. But presumably the person can say, actually, I'm still going on this. It's, you know, it's really good. Can I extend? Yeah. Cool.
Yeah. So it is all customer led. So if they have 6 books and they're not finished with them, they can keep them. We'll just renew them and then collect them for the next time. And there are no fines, so that's even better.
Shame that didn't exist 30 years ago. I've seen a couple of comments in the chat. I see Lainey's got her hand up. Just before I come to you, Lainey, I'm just going to read the 2 comments in the chat. So Alison from SCIA has said, it'd be great to welcome you to our day centres. I'm sure that some of our customers would like this. We also have a home care service, which I'm sure some of them would like to. We also have a home care service, which I'm sure some of them would like to be part of this too. So
okay, brilliant. So I can contact Alison and we can arrange something.
Alison, you there? Hi.
Hi. Yes, that would be great, Alison, if we could.
Yeah, absolutely. Yeah. I'll drop you an email and we can arrange some times to come out to the day centre. That'd be brilliant.
Fabulous.
Fantastic.
Thank you.
That's what we like, forming connections and links in this group. Absolutely fantastic. And a comment from Casey. Would this service cover the whole of Southampton?
Yes.
Cool. Smashing.
So it doesn't. We don't go out to sort of Chandlersford or Taunton, or so it's basically the city centre, Bitton, Portswood, Shoalin. That's probably as far as we go. So yeah, it does cover all Southampton.
Just kind of on that, just as my own kind of curiosity, are other libraries, in the Hampshire area and do you know if people are doing similar initiatives?
Yeah, most library services offer this type of service.
Cool.
I don't think many of them do the deliveries by electric cargo bike.
No, that is really cool. It's brilliantly sustainable.
Sometimes a lot of library authorities use volunteers and we've got part of that service as well, where we do use volunteers to do the deliveries and the collections. So it's we've got that part as well.
Smashing. Fantastic, thank you. Lainey, you did have your hand up, but it looks like it's come down. Was your question answered, or is that
kind of from the, I wanted to look at the area. So we support a lot of patients from West End. Do you go as far as West End?
We don't go out as far as West End, unfortunately.
That's a shame.
Just for the but you could contact Hampshire Library Service, because West End, Hedge End, those type of libraries are part of their remit, or sort of their boundary, if you like.
Okay.
So if you contact, I could probably find out a contact for you if that would help.
Yes, please.
Yeah.
Love it.
Thank you, Alison. Thank you.
Okay.
Smashing. Fantastic. Well, yeah, as you say, it sounds like a brilliant service, and I'm sure there are lots of people across the city who, enjoyed reading, and because of whatever circumstances, the type of people that the social prescribers and the community nurses in the room serve, don't have that opportunity anymore. So be able to not take down that barrier and actually come to people to deliver them reading is brilliant. It has fantastic wellbeing benefits. So yeah, fantastic service, and I'm sure our community navigators will do what we can to support. I'm sure the wider social prescriber network will be sending you lots of people coming through as well. I did send the leaflet you sent me out a couple of weeks ago.
Just on that, the leaflet itself is now updated. So if I can send you the updated leaflet, would that be okay?
That'll be fine. Yeah, that was going to be my next question. If you had any updated information, pop it over. And when I'll do the kind of sort of overview of what we discussed today, are you happy for me to share your details when they come out, or a kind of generic came out? Cool. So yeah, so if you send me that
absolutely.
leaflet. Do you have any? Is it just digital, or do you have any paper ones as well?
No, we've got printed publicity as well. So if anybody wants any of those, then we can send some over. Fabulous.
Wonderful. Does anyone have any further questions? No, I think we're good. Cool. Thank you so much for coming.
Thank you.
Brilliant.
Thank you.
Absolutely wonderful service. Really, really pleased to be able to have you today and promote it. Cool. If you think of anything, guys, please do just pop it in the chat, or we can come to it afterwards. I'll hand over to Debbie White, who's going to talk to us about the Adler Trust.
Hi everyone, can everyone hear me okay? Yeah, great. So yes, I am from Older Trust Charity, and I'm here to talk to you about one of our projects, which is Aldermore Community Farm. So I'm going to attempt to share my screen. I'm never great at this, so bear with me.
If it goes wrong for a reason, send it over to me and I'm happy to share for you. I think you're good. I think it's come through. I think you're good. Okay. Yeah, you are good.
Can everyone see that?
It's gone to click to exit full screen. I think you might have opened another window and you'll need to reshare that new window.
Oh gosh, right. Okay, we might be better just doing it on here if that's okay.
That's cool.
It did this last time and I couldn't yeah, it didn't want to let me do it. Okay, so we'll just, can everyone see okay-ish?
Yeah, that looks good from here.
Great. So Aldermore Community Farm, basically the whole of Older Trust Charity have their focus is people and really just improving sort of social and mental well-being. All of you, I'm sure, will know exactly how prevalent and where the need is for working and supporting people with their mental health. So for the farm, our why really is just that we want people to be more socially connected. We know that it impacts people in a positive way. They feel happier physically, they are healthier mentally, they're healthier. And as well, the nature element, people report being a lot more feeling like life is worthwhile when they have those connections to good quality nature. So the farm is a really beautiful place to come and connect with nature. We try and get absolutely everyone to come along to the farm and experience it, because it is just a really lovely place to go, and it just gives a sense of peace and calm. So if any of you ever want to visit, it's on Aldermore Road, so quite near Lord's Hill, sort of near the hospital, General Hospital. But it has a little farm shop. You can pot around the farm. If you have children, they can come and feed the chickens, or you can come and feed the chickens. It's just a very lovely place to visit. Our main sort of aims of the farm are, one, to build community. So we have lots of activity on the farm. We have volunteers coming about 4 days a week. We host sort of events. We have a bit of a cafe element to our farm shop. So we have a food specialist that cooks cakes and quiches and all sorts of lovely sort of food and lunch bits. And she uses the produce that we grow on the farm along with other locally sourced produce. So yeah, we're very passionate just about building community. We are also wanting to support individuals and increase sort of positive mental health and well-being. So that's largely done through our volunteer scheme and our therapeutic gardening, which I'll tell you a bit more about in a minute. And also just to promote environmentally friendly living. So everything we do on the farm, we're reusing, we're considering the environment, considering our impact on climate change. So, for example, our farm shop only stocks produce that is locally sourced to try and keep the sort of transition of produce to a sort of minimal. So we have like a pre-loved shed, which is now called our Aldermore Emporium. It's absolutely beautiful, and it's like a charity shop or a thrift store. You know, it's really lovely, and we have some great items that people come, and obviously all the profits go into the farm. So far this year, I'll just let you have a look at some of the numbers here, but we have had about 67 volunteer sessions. Actually, I probably wrote that in May, so we've had more since. We've got about 49 active volunteers, and since the beginning of the year, 11 of those volunteers are new. And we've also done some work experience placements. One of the projects that we're doing at the moment is therapeutic gardening. So far we've done therapeutic gardening courses to children in secondary schools, and they are for children who either have additional needs, they might be struggling to attend school or at risk of exclusion. So we have a group of 5 or 6 students from different schools coming and just doing some therapeutic gardening sessions on a weekly basis at the farm. And the results of those have just been really wonderful to see. Like, I'm going to show you a little video in a moment of one of the students we've had recently. It was so sweet. He just sort of said, I was really nervous about coming here, but I just feel so calm when I'm here. You know, he could feel the difference in, you know, in himself after the second session. So it was really, really good. And we do open days throughout the year. So we do 4 open days, and just invite anyone and everyone who'd like to come. And they're always really good fun. We have activities, we have food. Yeah, they're lovely events. And over the summer we're doing supper clubs, so if anyone would like to buy a ticket, our food specialist cooks a 3-course meal. It's hosted on the farm, which the last one was beautiful weather and we could sit out on the pergola, and yeah, they're really lovely evenings. It's almost like a little pop-up restaurant, so that's really nice. So I'll show you the video of one of our students who has been coming to therapeutic gardening. Hopefully this will work.
So this is Jerome from Romsey School. And Jerome, can you tell me about how you felt coming to the farm and how you feel after your second session with therapeutic gardening?
So when I first came to this farm, I was kind of scared. I didn't really want to go because I don't really like going to places I don't really know. But after my second time here, I really enjoy it, and I find it a really good escape from classrooms. And if you struggle with that, I think it's a really good place here.
Brilliant. Is there one thing that you enjoy here?
Probably feeding the chickens and holding the baby chickens.
Nice. Thank you, Jerome.
So Jerome is one of our youngest pupils that comes. And yeah, we find that just all the feedback from the pupils is really positive. But the gap that we have sort of noticed is that there's very little, so schools pay for the therapeutic sessions, but there's very little funding for people between the ages of 16 and 25. And yet we've had lots of inquiries for people within this age bracket who might need a bit of extra support, maybe support transitioning from education into employment, people struggling with their mental health. And so we have been applying for funding and really trying to get some funding to offer this sort of age bracket some therapeutic gardening courses. We've just secured our first bit of funding, so we're hoping that from about September, October, we'll run our first group for people in this age bracket. And I guess that's why I'd really love to share what we're doing with you guys, because if you know of people who would really benefit from this kind of volunteering and coming and getting the therapeutic gardening sessions, who fall into this age bracket, then we'd love to hear from you, really. So yeah, as I say, we're hoping to have our first group. It'll be a 12-week course from about September, October time. And then what we are hoping is if we can secure more funding, we can expand our volunteer programme. And if people who do the 12-week course want to carry on coming to the farm, then they can be included and fed into our volunteer programme. So I think that covers everything. Or just leave this. This is feedback from just a customer that visits the farm. Again, it really just shows how the farm can support people in times of need when mentally they are low. Yeah, we just find people really enjoy spending time on the farm. So this comment was from a lady who lost her father. She had a very big family. She wasn't sure where to go. And they just came and spent time on the farm and just found it really beneficial. And then lastly, I just thought I'd show you sort of our model of our charity. So Older Trust is the charity as a whole. As I said, our focus is people and improving mental and social well-being. And we do that by running various projects where we see a need. So the farm is one of our projects. But we also have Furgrove. So this is a counselling and support service for anyone who has experienced or been impacted by baby loss, whether that's miscarriage, stillbirth, sudden infant death. Yeah, Furgrove offers counselling and support. And then we also have the Healthy Relationships project, which goes into schools and they just talk about everything around relationships with an aim to sort of prevent domestic violence and abuse and sexual violence and sort of gender inequality. So there are three main projects: the farm, Furgrove, and Healthy Relationships. And that is it. Does anyone have any questions? I'll stop sharing my screen now.
Thank you very much for that wonderful presentation. I'm going to hand straight over to Emma. to ask her question.
Hi, it sounded really great, and I had no idea that the farm was even there. So I'm really interested to find out more. And I think I'm not working with anyone of the 16 to 25 age bracket, but I expect some of my colleagues might be. So I'll certainly share that information and see whether they might have anyone that could benefit from that. But I'm in the Learning Disability Adult Social Care team, and I do work with a couple of ladies who live very nearby.
Okay.
One in particular that does have a keen passion for gardening, and I'm just wondering whether there might be something that they could tap into there, perhaps if you've got details of the open day sessions, or if there's spaces currently for any volunteer support. Yeah, I just wanted to kind of know a little bit more about how they would find out a bit more about that.
Yeah, so I'll speak to our farm manager, Rich, about volunteer spaces. We're limited at the moment. We've got a lot, and in terms of our staffing capacity, I know we don't have loads of space, but we do usually have some space. So yeah, feel free. I'll put my email. I've just sent my email in the chat. Feel free to email me. I'll double check with Rich, our farm manager, about spaces. But the farm, so on Aldermore Road, the farm is open most days at some point. So even if they just want to come and drop in, they're very welcome. If the farm is open, then they're allowed to just walk in. They can come and introduce themselves to our farm shop manager, who will be there. They can come and wander around the farm and introduce themselves. But certainly we can let you know what we have going on for people that want to make it a more regular thing.
Great, thank you. And is there anything apart from the volunteering aspect? Obviously, you've mentioned about funding that you've got in place for therapeutic gardening for children and young people. Are there other sessions for adults with learning disabilities or mental health needs? And is there sort of funding elements for that, or?
Not at the moment. Mainly we support people through the volunteer scheme and therapeutic gardening. We do have a toddler group that's run by one of our volunteers on a Wednesday morning. So for parents of preschoolers, toddlers, on a Wednesday morning. I think at the moment it's only every other week. We're hoping to expand it at some point. But they can just come and do some little nature-based things with their children. They're very welcome to get coffee from our farm shop. So we have that, and we are hoping to expand those kinds of groups. So we would really love to do like a lunch for people who are retired or isolated. And yeah, we'd love any feedback if there are specific groups that you see a need for. We would love to hear what it is. And obviously, as we grow in those sorts of groups, we can let you know.
Great, thank you.
Brilliant. Yasmin.
Hi, Debbie. Thank you
Hi,
for that overview. I knew about Aldermore Community Farm, but I didn't realise about the other branches of things that you offer. So that's amazing. I just want to check I've understood correctly with the volunteers. Do you train the volunteers to be able to support, the kids coming in, or, because you were talking about mental health and those kind of things. So I'm just curious, is it the volunteers that support with that? Do you have other people that help specifically with those type of issues?
So we have a staff member who is our therapeutic gardening lead. They are who take all the children from the schools. We don't have volunteers supporting that. That's specifically led by our staff member, our therapeutic gardening lead. We then have the volunteer scheme, which is for any general volunteers wanting to just come and spend the day on the farm, be involved with the day-to-day running of the farm. And they are overseen by our staff members. So we have a volunteer supervisor, we have a lead grower, and they sort of input into the volunteers. We do then have specific volunteer roles for volunteers who are more able to sort of commit time and take on responsibility. We do have specific volunteer roles. So, for example, the person who runs our pre-loved shed is a volunteer, but she's very able to come 2 or 3 times a week. She sort of manages it herself. She liaises with staff. So we have specific volunteer roles like that who may oversee other volunteers, and we offer training to do that. But generally, yeah, so for the schools work, we don't include volunteers in that. And for day-to-day, just volunteering on the farm, they're overseen by our staff.
Okay, thank you.
Smashing. Thank you, Yasmin. Alison Fisher.
Thank you very much. Hello.
Hello.
Again, as I said earlier, I obviously oversee day centres, but it would be really useful or even maybe we could help with the elderly lunches that you're thinking about doing, but also we've got a specialist care team, and I think some of their customers might benefit from, because I just shouted at her, have you got any in the age group, and she's not 100% sure, but it'd be really good to, even if we catch up sometime, that I can bring Stephanie along and we can see what we can do to help support with from the specialist care team, and obviously my lovely ladies and gents at the day centres, because I'm sure they'd love to, because we've got so many of them who used to do the gardening and stuff that are not able, and it'd be just amazing to have that supported bit of networking kind of bit.
Yeah, absolutely. Feel free to email me. We can meet on the farm. I can show you around. Yeah.
Sounds great. Thank you.
Thanks, Alison. Brilliant. Yeah, wonderful. Fantastic. Thank you, Debbie. I had a couple of thoughts while the presentation was going on. Certainly in the kind of the sort of the age group you're looking at, 16 to 25, the community navigators that we have at SoLinked are from 18 upwards. So there would be within a cohort of that, not the 16, 17-year-olds so much, but there's something that we might be potentially able to refer people onto. Are you linked up with some of the youth and networks and organisations in the city, like No Limits or Young Southampton, things like that as well?
Yeah, so actually through one of our other projects, the Healthy Relationships project, I'm the project lead for that, and we connect with No Limits. So yeah, we have some good connections already. I know Elaine came with some of her colleagues to look around the farm in terms of potentially there being the opportunity with the social prescribing. So yeah.
Cool. And one of the other thoughts I had when you showed that feedback about the lady who was bereaved, and then she came to your farm after the death of her father, and it got me thinking about how when I worked at the carer service, we ran a bereavement session for carers who had lost their loved ones, and they were coming to terms with it. But it got me thinking about how things like this, about being in nature, about working with animals, being around people, volunteering, is a really brilliant way to overcome grief and kind of be able to work through it. So I did wonder if maybe that could be something to link up with the carer service as well, as something that they could sort of link people with who perhaps might be going through that process, to kind of not necessarily kind of go for the kind of talking therapy approach, but actually about kind of being in nature, being around animals, because that has been proven to alleviate people's levels of grief and things.
Yeah, well, I'll keep you posted on that, because one of our other projects is the Fairgrove Centre, who counsel for baby loss, and we're actually looking at how the two can partner, that we can offer counselling but then offer progressive sort of group service where people come and use the farm to process some of their grief. We'd quite like to trial it with that client group first, but our thinking was exactly that once we've done it with that client group, we could move on to other people who have experienced grief and loss in other areas of their life.
Fantastic. Yeah, keep us informed of that, because it's an area in the city that is very oversubscribed and really needed. So there'll be definitely a lot of need for it. I can see Alex has got a hand up. I will move on to him. I've got one question, which is a very sort of practical question. How kind of accessible transport always comes up as a barrier for people? How kind of accessible by public transport is the farm for people to get to?
Yeah, so it is on a bus route, and you're testing me now because I can't remember the bus. We're quite near the hospital, sort of in between the hospital and the Sainsbury's in Lords Hill on that Aldermore Road.
I know what you mean.
go and ask what bus it is. Sorry.
It's on a bus route. That's probably enough. And obviously, you know, there are people. Oh, voice keeps breaking. There are people who are able to access public transport and come along. But you know, good to know that you know it's well served by a link. You know, and I think that bus goes up from like Shirley Precinct as well. So there'll be people who don't get across there. Smashing.
The only thing I would just say, just in case it's relevant for anyone wanting to recommend people to visit, is just on in the entrance into the farm, the ground is a bit uneven at the moment. It's not great. So anyone with disabilities where they're going to struggle to sort of get down a bit of sort of slightly sloping and it's slightly uneven, we are looking for funding to sort it out because we really want to make sure we're accessible to everyone. And that has been something that people have fed back. But I just sort of wanted to let everyone know that if you have people with disabilities, it might be a bit of a struggle.
Smashing, and it's good to know so that when you know the social prescribers and the community members are talking to people, they can kind of hold that conversation with them, because you don't kind of want someone to turn up and go, I turned up to this thing. I jumped on the number 17 bus, as someone popped in the chat, and was unable to come along because it wasn't an accessible kind of environment. But you know, that's Southampton Farms. It's good to know that you're looking to kind of ways to improve that. Yeah, the number 17 that pretty much dissects the entire of the city, actually. Alex. You're on mute, my friend.
Hello, hi. Alex from Solinked SVS. Just want to say, we facilitate Southampton Green Network, and last year in September we had a meeting at the Aldermore Farm, and it was absolutely brilliant. And thank you. It was Richard Pitt, if I remember well, who was our host. We were treated with a talk on permaculture, which was really, really fascinating and interesting. And all in all, it was a great day. Just wanted to say how wonderful that place is, venue, and we all enjoyed. We got really positive feedback from our members. So thank you for that again. And again, I mean, as well, I mean, maybe Debbie, you also are open to organize some organizations who are present here. Maybe they can have some of their meetings there. Obviously, talking to you, Debbie, and your colleagues. And it's a really great place to also have meetings, like organizational meetings. So yes, just to say, really, really good venue. And my colleague Jo Payne, who was just here listening to this conversation, she said that she loved the place and her children love the place. She goes there very often. Remember, community on the farm, the shop was really wonderful, so we bought some really, really great things there. So just to mention that. Thank you.
Good.
Thanks.
Yeah, we've actually just had like an art group who they wanted to come and host their art group on the farm, but they wanted lunch included, so our food specialist provided lunch. They paid a set amount per head, but absolutely that we'd like to get into more of that if it's helpful for staff meetings. And yeah, they can use our coffee shop and cake and things like that. Yeah, we'd love to support in that way, and especially for staff teams, like we should be looking after our staff mental well-being as well. So it's great to come and use a facility like the farm and give them that space away from work. So yeah.
Smashing. Thank you. There's one question in the chat. Are you linked with the universities? From Jade.
Oh, let's have a look. Are you linked up with the universities? That's a good question. I don't think specifically we are linked up with the universities, no.
Okay, we do some work, and we're very linked through Alex's role in Peru and CPAR and work that we do in So Linked, we're linked to the universities. That is something, if you wanted to explore, we could look to do. And Jade is the prescriber over at the University Health Service, which is based over on Highfield campus as well. Brilliant. So there are links in the room if that was the link you wanted to explore. Cool.
Yeah, thank you.
Smashing. Thank you very much. We'll move on. We are a bit behind schedule, actually, which is terrible. That's my poor chairing, so I do apologise. Anne-Marie.
Hi, everyone. Nice to meet you virtually. Thanks, Jay, for the introduction. My name is Anne-Marie, and I am a primary care engagement coordinator for Solent NHS Trust. So if I'll say a little bit about what I do, because my job title doesn't really give away too much. But my main role is looking at how we can connect Solent services better with primary care. So one of the main challenges that we have in Solent is that there are a lot of service changes happening all the time, and the same in primary care. There's a lot of things that are changing, but actually how can we kind of work better together? How can we work more integrated? How can we communicate better? So my role is kind of really quite a wide remit of looking at all of those things. One of the things that I wanted to speak to you guys about today was a new training that we're developing, and I just wondered if I could ask you from the offset, and I don't, if you want to just like raise a hand, if you have heard of a communication tool called SBAR. I'll just give you a couple of moments. If you have heard of it, do you want to raise your hand? No hands raised. Okay. All right. My other question was going to be, have any of you used SBAR? But obviously, if you've not heard of SBAR, then you're not going to have used SBAR. So one of the things that I wanted to speak to you about today was about this training that we are putting together about SBAR. And I've got a couple of slides that I will share with you. Just bear with me a mo. Going to share my screen and hopefully this will work. You see that? Yeah, I'm getting a thumbs up. Brilliant. Okay, so we are putting together some training which is going to be available in the form of a video. The video will be about 20 minutes long, and it is all about this new well, it's not new, but this training called SBAR, with communication tool, and which I'll briefly talk to you about today, which hopefully will whet your appetite for what's to come, because this training video, we're going to make it available on our website for anyone, and it is specifically aimed at people who are working in primary care. So what is SBAR? It's a structured communication tool split into 4 sections or prompts. So SBAR stands for 4 different things, which I'll come on to. And what it does specifically is it helps with the handover of relevant information quickly, specifically thinking about patient information, but it also supports staff to anticipate the information that they're going to be needed by colleagues to formulate important communications with the right level of detail. So that's what it stands for: situation, background, assessment and recommendation. And it was first developed by the USA military in the 1940s when they were communicating on nuclear submarines. And it's been around in the NHS now for a long time, over 20 years, but it's something that's more coming to the forefront in more recent times, and really, you know, first came into the NHS around communication between healthcare professionals, like in hospital for patients that needed urgent attention. And we're now, as I say, looking at other ways that we can use SBAR across the NHS and across other organisations. And it doesn't just have to be used in the NHS, it can be used absolutely anywhere. So there's a few reasons why we need to consider using SBAR when communicating information about patients, particularly in primary care. It takes out uncertainty from important communication. So, you know, I imagine that you've either been the recipient of a conversation or actually made a conversation where, you know, there've been maybe assumptions put in, there's been vagueness, maybe particularly as well. One of the things that we're looking at is actually how do you make a communication about a patient when maybe you're communicating with a consultant or a GP, and there's that kind of, I guess, hierarchy or power imbalance maybe in place that makes you maybe feel like, actually, I don't know really how to communicate this information because of somebody's position. It takes away communication barriers. So when we're speaking verbally or written communication using this shared model, it just means that everybody's speaking from the same hymn sheet with the same information. I've already mentioned about the kind of levelling of traditional hierarchy that it can do. It's also really easy to remember the acronym and helps staff to think about and prepare before communicating. And can also, any time you want to hand over information, that can make it quick, it can make it effective, and releasing more time for that patient care that we all want to be doing. So lots of ways that you could use this in primary care. So we could use it in any urgent or non-urgent communication. So examples might be if you're asking a service to take action. So if you wanted to perhaps refer to like a community or acute service, you could use SBAR in your email or your referral information. And in fact, within Solent NHS Trust, we've now got a new referral form when you refer to community nursing and CIS, which actually asks you to document the referral using SBAR. So you're actually writing out the situation, the background, the assessment and the recommendation within your referral. And that's something that we're probably going to see more and more as time goes on. In any written or verbal exchanges, including email. So if you're writing a referral, if you're speaking to primary care team members about patients, emails and telephone conversations with other healthcare professionals and NHS services, you can use SBAR. And any escalation or handover, if any of you attend like multidisciplinary team meetings, you may have seen use of SBAR. Maybe you weren't aware of it, but it's coming more and more with MDT meetings that they're using this approach when speaking about individual patients, because it presents their case really succinctly and talks very clearly about what they want to get out of the meeting. And also in sort of clinical and managerial environments, things like patient handover. So very briefly, just going to tell you what each part of it is, and then I'll go on and tell you a little bit more about our training. So situation would be kind of background information. So who you are, your role, where you come from, the patient you're talking about, and the reason for your call, your email or your report. It would include things specifically about like the age and the sex of the patient, so you can clearly identify who it is that you're talking about. And also the location of the patient. Are they at home? Are they within your GP practice? Are they in hospital at the time? Maybe who has referred the patient, who's asked you to carry out the action, what your concerns and worries are about the patient. And your background, that's going to include things like their medical history, maybe any kind of tests that they're having done or that they've had done, any lab results, any admission dates, you know, kind of all of that background information, what their social setup is. Do they live alone? Do they have a package of care? Are they in a care home? And any other input from other community services that would be relevant. And then their assessments, that's going to include, again, this is quite probably medical, but you can kind of look at how you could use it in terms of social prescribing as well. So we've got the actual test results, things like scoring tools, how the person presents, you know, what do they look like? Are they alert? Are they orientated? What's their mobility and speech like? Do they have any do not attempt resuscitation status or any advanced care planning that you need to be aware of? Any other information, things like mental capacity assessment. And the key thing is with the assessment is I get often people saying to me, oh, well, we don't do the medical stuff, or I don't know how to make an assessment. And that's absolutely fine, because all you really need to say in this section, if you don't have anything else in terms of a formal assessment, is I'm not sure what the problem is, but I am really worried. And that's totally valid, just to use your judgment and say, you know, I'm worried. And then the recommendation is really what you want that person to do. So it could be anything from asking somebody to go in and review a patient. It could be asking the GP to maybe take some bloods. It could be asking a colleague to refer them to, you know, what a group that would help them. But be really specific about what you want and the time frame. Making suggestions, clarifying expectations and explaining what you've already done. So my example here was made a referral to a social prescriber. And if it's a phone call, to ask the receiver to read back, just to ensure that you've been understood. So I'm just going to stop sharing my screen. So a very whistle stop tour just in terms of what SBAR is. Oh, I can see a hand up. Is that a question for me to take now or at the end?
Where was the hand, Marie?
Alex?
Alex? It might have been is that your hand, Alex? Was that a legacy hand? Yep. Was that a hand?
Well, it's Alex Ivanchevich, is not me, and I don't see my hand raised here.
Okay,
So
It might have been a legacy hand from
a legacy hand. Apologies.
Alex.
So that was just a really whistle stop tour of what we're kind of going to be covering in the training. And the training video, as I said, it's going to be a 20-minute video, and the idea is it's for literally everyone or anyone working in primary care. So it's not like super clinical. We try to make it really practical. We've got lots of, we've got a few different videos within it of like we've got a video of somebody on the phone actually showing you what SBAR is like on a telephone call, and then what how kind of, I guess, uncoordinated or chaotic the phone call might look like if you don't use SBAR. We've also got some different primary care staff talking about their own experience of using SBAR. So I really want to just come on here today just to say that we're putting this training together, and we'd love people to actually watch the training and to give us some feedback once it's out. So I'm more than happy to share the video with you, Joe, once we've kind of got it finalised and get some feedback. I also just wanted to mention a couple of other projects that we are involved in that might be relevant to your network. One of them is around multidisciplinary team mapping. So I imagine several of you will be linked in. You're muted, Joe. Oh, sorry. I thought you were talking to me. Apologies.
No, sorry. I was actually just talking to Jenny about the running order. I do apologise.
No worries. So one of them is, yes, I'm aware many of you will be linked into like multidisciplinary team meetings that perhaps happen within your GP practices or PCNs. One of the things that we're trying to look at the moment is what MDT meetings run in all of the different practices and PCNs. Like what is their kind of high level summary, who attends them, can people refer into them, and what the contact details are. And we're doing that for both primary care and also for Solent services, so that anybody working in primary care, this is specifically adult services, can see, oh, I know Solent run a service for people with severe bladder and bowel issues. Oh, I can see a contact details here. I'm going to contact them and ask whether they might consider seeing my patient in their MDT. So we're looking at how we can kind of integrate our services better and look at how we can do cross referrals better. I've got a theory that in like lots of the MDT meetings that run around Southampton, probably the same patients are being discussed in like 3 or 4 different MDTs. So how can we look at streamlining those services so that we're all working, we're having to like attend less meetings, but that we're doing the right things and seeing the right patients. And we're also doing a big project at the moment looking at how we communicate with primary care in terms of making sure that, like, one of the issues that we're having at the moment is for our practices on System 1. Often our services will send like a task to the practice via System 1, and it will sit in some inbox that's never monitored, and then that patient slips through the net. So we're looking at how we can communicate better together as well. So I know that's really kind of quick, but I'm happy to take any questions now. I'm equally happy for you to share my email address with your group, and if anybody's got any ideas about how we could work better together, if anyone's got any challenges, any areas where they think, gosh, like in terms of Solent services, this is really bad or this is great, I'd love to hear from you as well, just to see, are there any particular services that you're struggling with, that we can help kind of put some things in place to make improvements.
Smashing, fantastic, Anne-Marie. Certainly from the kind of individuals in the room sort of working in that primary care setting, does anyone have any thoughts or feedback to Anne-Marie about SBAR and how it works, and if it could improve practice, or any kind of questions further on it? Okay, cool. I would be very interested to see that video, Anne-Marie. It's very interesting what you were saying. So I think what I would like to do is kind of see that and see if there's anything that we can take into our community setting.
Yeah, absolutely.
Kind of best practice, but also perhaps have a conversation outside of this arena about it as well. Sounds really good. I think if you're happy, send that to me. and then I can forward it. We have sort of 17 or so people here today, but the video goes out to the wider network. There are community groups and services together as well, so it will go to them as well. But I think, do you have a kind of, how do you want to kind of receive feedback? Do you want kind of emails sort of coming in, or have you got a kind of feedback form set up, or how do you want to kind of
I mean, we're just doing it by email really, so I can put my email address in the chat,
Cool.
and then if anybody's got any specific questions, or even just wants to connect and find out more about what we're doing, very happy to help with that.
Smashing, fantastic. Yeah, so if you have to do that, and then just to confirm, you're happy for me to kind of send that out on the wider network as well when I send this out. Cool.
Amazing.
Any questions before we wrap this section up? Cool. Fantastic. Thank you very much for coming. Thank you for talking.
You're welcome.
We've got one more speaker who's just sat to my left, which is Jenny, who's going to talk about a piece of research work she's doing. Jenny, I'm going to move the screen over to you. Just want to say hello and introduce yourself.
Hi, yes, thank you. I'm sort of gate crashing today, so thanks for having me, and thanks for all the other talks, really interesting. I'm here from the University of Southampton, and we're just jumping through the final hoops of bureaucracy to get a project up and running, looking at social prescribing specifically for people living with dementia and their carers secondary. And what we're going to be doing is hopefully co-designing with people living with dementia, their carers, social prescribers, GPs, practice nurses, and care commissioners to talk about what social prescribing is looking like for people living with dementia at the moment, and how can we maybe improve this. And we're working in 5 areas across the country, so Southampton is going to be one of these 5, and so I'm just here to basically say there is a study coming and just to let you know about it, so that if you see that it comes up, we'll be recruiting through clinics directly, because that's the way that the ethics is going. So it may or may not be attached to a clinic that you are working with, but I will also be looking to speak to people outside of those specific clinics. If you have a special interest in people with dementia, or you've had experience working with people living with dementia, but it's you have thoughts or concerns about it at all, because what we're trying to do is get as many opinions and stories, feedback, ideas from everybody and from as many people as possible, to try to make this as inclusive and beneficial as possible. And then once we've developed the intervention, we want to trial it, and then hopefully scale it up so that we can have some consistency nationwide for this patient cohort. So I've got a little, actually I could just put my contact details in the chat, but I also did prepare a little slide just with the basic information. So if you want to look let me see, I'm on, oh, here it is. This one?
Yep.
Is it this one?
That's one.
Can you see that?
I think that's, yeah.
Okay, can you see that? So that's the information. We've got the website there, which is to the main project page, which covers everything. It's a massive thing. There's the PPI, there's the newsletters. We're looking for volunteers for people living with dementia that may want to be involved. So just trying to spread the word at the moment. There's the Twitter handle there too, and that's my email address. If you're attached to a clinic that will be actively recruiting through, we might ask you to participate as a social prescriber. And otherwise, if you have patients or clients who have dementia and would like to be involved in something like this, then we'd want to hear from them too. So I will just, if you have any questions about it, please get in touch. What do I do? Press this little one.
I see a hand from Alison.
My hand likes going up today, Joan. I think it would be, I know obviously you're going to do more social prescribers, but I think my majority of my customers in the day centre have dementia. So it might be worth us maybe catching up. I'm also, depending if you're just covering Southampton, but I'm also the chairperson for the Buzzard and Hamble and Hound Dementia Action Group. So I can help spread the word from that point of view as well. That would help.
Yes, that would be wonderful. Did you catch my email on the slide, or shall I pop it in this chat as well? So I'll pop it in the chat as well, just in case.
Yep.
Pop it in the chat, and it will go out with the minutes and slides and things afterwards there.
Okay. Cool. Yeah, thank you very much, Alison. That would be great.
Thanks,
No
Alison.
worries. No worries.
Hello. Any other questions from the group? Cool. We've talked. We've already met and kind of talked, and I've given Jenny a bit of an overview about the work that we did around this sort of community navigation that we had for our previous service for the Alzheimer's Society. So we've spoken there. But if you want to link with Jenny, the email's there. We'll send some more information out about it. Please do feel free to get in touch with her. It sounds like a fantastic study. Cool. Any questions before we sort of come to the half-time break? Cool. Good stuff. Okay, we'll call a break there. I would quite like some water and a cup of tea. So it's 6 minutes past. We come back sort of 10 past, 11 minutes past, and we'll do the second half of the meeting. Speakers, you're welcome to stick around and talk as part of the meeting and sort of find out what people are saying, what's going on. But if you have kind of other things to go to, that's absolutely A-okay as well. Thank you very much to all our speakers today for contributing, and we'll send all your information out. Yeah, we'll see you in 5 minutes.
Thank you for having me. Bye, everyone.
Thank you very much. Right.